All right, so just want to go through some tools of treatment and monitoring. Um, and the COVID breakout, but really any pandemic, you'll get some crossover here. So we have three different tools. One is actually garbage. I need to replace this, but it's just a lesson learned. So we have temperature, we have blood pressure, we have oxygen levels. So COVID produces with a slight low grade fever um, after the 14 to 30-day incubation period. And so you can monitor people with this, but just know it's a limited hangout as far as who is infected or not, just because the way it's structured. So again, general isolation. Nobody's clear unless they've been clear for 30 days, but you can monitor to see if they're coming down with anything. And you can start treatment early during the ramp up of the disease as well. So this is good for telling how long people have not been affected, but can't tell if somebody's actually been infected. So we have the pulse oximeter. Pulse oximeter obviously measures blood oxygen. A lot of this illness is pneumonia. Presents in about 10 to 16%, and you'll see blood oxygen levels go down. Anyone below 90% oxygen, they will usually require some kind of oxygen therapy. So if you have any CPAP available, any kind of oxygen generation, that's good. They want to study the Wim breathing method to increase oxygen levels in blood if they don't have that. But it's potential that people relax, but also focus on breathing, focus on raising up their blood oxygen level. Normal rate is around 96%, but anywhere between 93 to 96 is good. You get below 90 and your heart starts working harder, which causes acceleration of the problems. You start more labored breathing, more inflammation, etc. So that is that. You want to get a baseline of people's blood pressure as well at various times of the day. Monitor that. That's one of the first indicators of this problem. The ACE2 receptor is part of what regulates blood pressure, and the ACE2 receptor is where the virus infects. It'll raise, you'll see it in the blood pressure first. So if you see wide variations, that's what they're hypothesizing why people are, just dropping to the floor because of sudden changes in blood pressure. So that is that. Now, interesting thing about this particular device, I think $20-$30 on Amazon. The reading is completely false. So it says I was in like emergency mode of blood pressure, but it was not the case. I was actually normal. So lesson learned: the forearm blood pressure is not the best way. Get the armband one and compare it to the ones you see in like Walmart and any one free one that's available. See if it's accurate or not. But failed piece of equipment here, but three essential elements for monitoring, and there will be good tools if you have to self treat. Take care.